Joining us live to continue our coverage via Skype from Washington, D.C. is U.S. Representative Adam Schiff.
He is chairman of the House Intelligence Committee and a 10-time elected congressman from Burbank. Good morning.
Good morning.
The $484 billion relief package, it overwhelmingly passed by the House, headed now to the president's desk. Democrats, though, already pushing for more funding for state and local governments. What is the HEROES Fund?
The HEROES Fund would essentially pay hazard pay to those that are on the front lines, those that are working in our hospitals, our health clinics, our emergency responders, even people working in grocery stores and making sure that the food gets to Americans during this time of crisis. We think it's appropriate given the added risk that these folks are facing, and they're doing it on our behalf. So that's what the HERO Fund would involve.
The House has also created a new select committee to oversee how the millions or billions of dollars are going toward coronavirus relief. Also, President Trump and the administration's reaction in the early days to this COVID crisis. As you know, Republicans are saying this is redundant. What's your response to that?
We're going to need to do a lot more than we have already. We added a new infusion to help small businesses. We need to make sure that actually gets to the smallest of those businesses that had a hard time in the first round getting help. But more than that, state and local governments are hemorrhaging money right now. The loss of revenue because the economy has tanked as a result of this crisis is really putting states and cities at their financial limit. We don't want a new massive round of layoffs, and those states also employ police and firefighters, nurses, educators. So I think it's irresponsible to suggest, as Mitch McConnell has, that we should simply allow states to go bankrupt. So there's going to have to be a lot more that we're going to have to do to keep the country afloat economically until we get on the other side of this healthcare curve, and we still have some distance to go.
This right here getting a lot of attention and reaction this morning regarding yesterday, President Trump suggesting the internal use of ultraviolet light and injections of disinfectant to kill the coronavirus. And then there was a moment where there was a bit of a contradiction between Dr. Anthony Fauci on more testing and what the president was saying. What do you think should be done at the federal level to give people the most credible and unified information possible?
Well, I think we should rely on the experts. We have very good healthcare experts. I think that Dr. Fauci is very, very good. People at CDC, at NIH. I really think it's a disservice when the president opines on cures that he believes in, and people go out and they try things that can injure their health. We saw an early study of hydroxychloroquine that the president had been promoting can actually cause serious complications for people. And so I think we would benefit from hearing the healthcare experts and less of this self-promotion and, frankly, opining on treatments by the president. I will say also in reference to that select committee that you mentioned, one of the purposes of that select committee, and it should be bipartisan and work that way, is to oversee expenditures to make sure they're going for testing, that they're developing new and appropriate treatments, that the test kits that are using are effective, that expenditures for small businesses or large businesses are going as they should and not being rewarded on the basis of who the president wants to favor or punish, as well with customers of the banks they want to favor. So we do need oversight and oversight both of these, potential remedies, sometimes promoted without much thought by the president, but also oversight of these expenditures.
As you know, the president was pushing chloroquine and hydrochloroquine as potential therapies. They are being studied in clinical settings right now. But the former top scientist for Health and Human Services, Rick Bright, was removed for not pushing that, or so he says. He wants an investigation into that. He questioned the value of those drugs. I would imagine that's disturbing to you, and I was wondering, what do you think should be done with regard to Mr. Bright?
Well, I understand that he's filing a whistleblower complaint, and that complaint should be investigated. This is a very serious charge that he's making, that essentially he was sidelined because he was pointing out that the science wasn't supportive, or we hadn't done the work to make sure that this medication the president was promoting would in fact help and not hurt people. And indeed, one of the early studies that came back in the VA showed that it hurt people and it had to be very carefully examined. That's what we want our scientists to do, to speak truth to power, not engage in happy talk that could get people killed. So that needs to be investigated. And one concern I have, frankly, is those that would do the investigation, in addition to Congress, include inspector generals. Well, those are the people that the president has been firing because they have been doing their oversight job appropriately. We're going to have to, I think, put in legislation, I'm working on this now, a requirement that an inspector general can't be fired except for good cause, because we don't want any president, this one or any other, to be able to fire an inspector general for doing their job in order for the president to hide misconduct or malfeasance.
You had proposed a 9/11 style commission to look at, in its entirety, the administration response to the pandemic. Does the select committee that's been created, does that answer your concern or what you had wanted, or do you want a separate commission that would look into it?
Really two different tasks. The select committee that has been stood up now will look at the expenditures going out. Are we spending the money on ventilators? Are we spending it on protective gear? Is the administration playing favorites in terms of the allocation of that $500 billion fund for industry to make sure that we eliminate any waste, fraud, abuse, or favoritism in the expenditure of those funds? The commission that I have in mind wouldn't be stood up until next year, and it would do a whole of government review of why we were so ill prepared for this, why we didn't have the protective gear we needed, why it took so long to roll out testing, why we didn't see the pandemic coming before we did, or if we did see it, why we didn't do more about it, what we need to do, most importantly, to protect the country going forward. That's the kind of work that the 9/11 Commission did after that terrorist attack. And its recommendations were very important and have helped protect the country from any further attacks since. If a pandemic commission can protect the country against any future pandemic, it will certainly be more than worth the effort.
Closer to home, here in Los Angeles, the annual Armenian genocide commemoration, it typically fills the streets of Hollywood and Glendale, people marching in their cars as well. It will be observed online this year because of COVID-19. We know last year you introduced the bipartisan bill to recognize the systematic killing of 1.5 million Armenians. What are some of those virtual activities that are planned for today?
There are candlelight vigils. I'll be putting a candle in my window, and people will be all over the country. There are video conferences. There are video events. And so there'll be any number of ways for people to gather, as we do in this era of pandemic, through video, through telephone, through communal action. We won't be able to gather by the tens of thousands or even 100,000 strong in the streets of Los Angeles as we have in the past, but we'll be gathering in the form that we can. And we have something really to celebrate this year, even as we remember those that were lost. And that is, for the first time in decades, we are able to pass in the House and Senate the genocide commemoration bill. I've carried that bill now for almost 20 years, and this is the first year in decades Congress has gone on record, and the Senate, in bipartisan fashion, recognizing the Armenian genocide.
And Chairman Schiff, you know that so many people here in Southern California, that means so much to them. Thank you, sir, for the time this morning, and be well, be healthy.